The rest of the world requires the NHS system and our partners in social care to have a plan for the next 5 years. The point about today is how do practitioners, clinicians, social care leaders, commissioners of social care work together to change the way we do things? This workshop today, there's a cross-section of doctors, therapists, people who work for the county council in social care, people who work for the NHS.
People who work in estates, governance, a huge mixture.
But all with that common purpose of helping make things better for the people who use our services.
Well, the challenges are really quite significant, and I think what's really important to recognise is that we now all understand what those challenges are.
We spend more money than we earn, and allied to that we have problems with quality and the quality of our outcome, and some enormous health inequalities.
Difficulties with recruiting staff in health service, social care.
We've had 8 different assessments of health services structure in particularly the north of the county, but nothing realistically has changed.
We are very much working in our separate organisations with limited networks between ourselves.
I think the challenge is actually to make it a reality. It's to take everyone's views and an understanding of what's important right across the health and social care economy and bring that together.
If nothing changes, then over the next couple of years we'll see the health and social care system begin to creak and begin to fragment.
But it's an avoidable future. We've got a glimpse, we've got a chance, an opportunity, and we've just got to work together to get that.
I think in working together better to deliver our plan is all about, it boils down to relationships, and it's the relationships we have both at the leadership level across the organisation, at senior leadership, but also then at every other level within the organisation.
I think we need to understand each other more and able to work better together. I think breaking down barriers is going to be really important to allow collaborative working. We need to empower people to be able to speak up.
So staff doesn't feel obliged to do things, they feel that they want to do things, be passionate about it and share information with each other.
We need to start talking about not helping each other across our organisational boundaries. We need to start creating vehicles that actually implement that change and own that change.
What needs to be different this time for things to succeed is there needs to be very real, systematic public engagement with a very clear and transparent explanation of the reasons behind any restructuring and the advantages that patients will see.
I think we need a more holistic, collaborative, every team involved approach, something that will actually make a difference both now and for the future.
If we were to be in a sort of a single unified organisation where we would all be sharing the same goals and objectives and not pulling and pushing against each other, I think that might make it a little bit easier to work with.
When we hit difficulties and trials and tribulations, we don't back off and think, hey, we need a new plan, but we keep going with some resilience and that we deliver the things that we say we're going to deliver.
We do have a common aim, and it doesn't matter what background you're from and what discipline you work in. We're all here because we want to improve health services for the population of Cumbria.
If we succeed with the kind of ideas that we're talking about today, we end up with a more patient-focused care where patients are treated at the right time in the right place by the right professional.
I think that we all need to remember all the time that the reason that we do this work is that we want things to be better for patients and for people who live here and use our services here, and that's the reason why we all have a job, and that's the reason why we all get up and go to work in the morning.
And at the end of the day, we'll have a better outcome for health, improve the quality of life, and also have not only the length of life, but also the quality of life would be better.
That would make a big impact in improving the health of the population, which in turn it would make everybody happier and healthier.